President Trump talked during the campaign in 2024 about having concepts of a healthcare plan. This is kind of the concepts. This is not a detailed plan by any means.
Hello, one and all, and welcome back to The Rural Impact. I'm Michelle Rathman, and I am so grateful that you have joined us for another conversation that does work hard to connect the dots between policy and rural everything, and as we say so often, rural quality of life. Now, before we dive into our serious conversations that we are having today, and they are serious conversations, I do want to share with you that we have officially launched, drum roll please, our Rural Impact merchandise. And you can find everything from hats to mugs, notebooks, and my favorite, reusable shop rural bags. So when you visit theruralimpact.com, look for our merch link, and we would love to have you have a look, buy a few things that we think that you're going to appreciate. I'm going to just show you one little thing right now that I love, which is my notebook. And on the very back, it has, "These are not light subjects." So when you do purchase items from our store, not only are you supporting us, but I want to tell you that we are also identifying rural serving nonprofits and organizations that support rural. And so when you do support us, we're going to turn around and make donations to those whom we identify. And you can find more information on that very soon on our website. Again, that's theruralimpact.com. And while you're there, why don't you just go ahead and click that subscribe button, because that way you'll get our newsletters right in your inbox. Okay, with that news out of the way, I am going to shift back to policy. So let me tell you about what conversations of what we're going to cover today on the show. If you listened to our last episode, you know we kicked off our Tracking Transformation series, and that is really about tracking the $50 billion taxpayer fund that was set aside in HR 1 to, as they say, transform rural health. So I won't get into that, but we are going to have kind of a conversation that is parallel to that. So it's not going to be about the Rural Health Transformation Fund per se, but it is really an extremely timely conversation, because we are talking about the January 15th announcement that came out from the White House, and that is President Trump's call for Congress to enact what he calls the Great American Healthcare Plan, which, as is described in this plan, this comprehensive plan, as they say, is to lower drug prices, insurance premiums, hold bigger insurance companies accountable, and maximize price transparency, all of which does have the potential to have a very positive impact for rural. However, without specific details on implementation, many of the two-page plan that's been put out so far and its promises remain speculative at best. The devil, as they say, is in the details. Okay, so what are we talking about today? If you guessed the Great American Healthcare Plan, you would be correct. And to have this early in the game conversation, because again, it's super early in the game, I'm pleased to be joined again by Larry Levitt, Executive Vice President for Health Policy at KFF, and grateful to have him back. To be sure, if you recall, Larry joined us in early 2025 to talk about shifts in health policy back then. So a lot has changed since that time. Now, after my conversation with Larry in a very short break, we are going to shift gears to one of the most pressing policy issues of our time, in my view, and that is the state of affairs with respect to food and nutrition policy. Now, if you're not following along, let me just get you up to speed. I want to just give you a few numbers. The first number is 187 billion. 187 billion. That is the number that has been taken out, cut from the federal government in HR 1 from the Supplemental Nutrition Assistance Program known as SNAP. A few other numbers to know about, that is 50, 25, and 75. Well, what does that mean? HR 1 also reduces the federal share of SNAP administrative costs from 50% to 25%. And that means that states will be required to cover 75% of the administrative costs starting in fiscal year 2027. That is a big shift, to be sure. Now, if you're hearing about SNAP cost shifts, these are the numbers to pay attention to, because as you'll hear from my second guest, Gina Plata-Nino, Director of SNAP for Food Research and Action Center, these shifts will, not could, will increase hunger, strain state budgets, and deepen economic risks. I've had several conversations about this very thing this week. So again, I'm just really grateful that you're here and paying attention, and that whatever you learned today, that you might be able to share with those in your circle as well. As I said, these are not light subjects, but we're going to do all we can to enlighten you. So on these policies, on the rural impact, that's what we're here to do. So again, as I always say, I invite you to sit back and tune out that background noise. We know it's going to be there waiting for you when your short time with me is over, and hear my conversations with Larry Levitt and Gina Plata-Nino. Are you ready? I know I am, so let's go. Hey, Larry Levitt, Executive Vice President for Health Policy at KFF. Welcome back to The Rural Impact. I mean it when I say it. I really do. We are grateful to have you join us again, because the topic of health policy in America remains one of the most pressing issues of our time. Maybe some would not agree, but I think you do.
I do. And thanks for having me back.
It's our pleasure. Okay, so Larry, as folks know who listen to this podcast, we've launched a series in 26 that we are calling Tracking Transformation, and that's all about the Rural Health Transformation Fund. That's not what this conversation is about, but it's an adjacent conversation, because on January 15th, just a few days ago, President Trump announced his, in quote, great healthcare plan. And if people have seen me right, just because we do put the word great in front of something doesn't magically make it so. And it's really what he says, the quote, broad healthcare initiative that will slash prescription drug prices, reduce insurance premiums, hold big insurance companies accountable, and maximize price transparency in the American healthcare system. Again, well, this sounds really great. The one pager I saw on it is very short on details, as they say. So maybe you, because you are so in the know, maybe you can give us your analysis. Let's go down the list of the things that this promises to do: lower drug prices, lower insurance premiums, which includes the possibility of sending people money directly to those who are eligible. So what can you share with us? What do you know?
Yeah. So as you said, it's a one-page plan. The more detailed version of it is 2 pages. So President Trump talked during the campaign in 2024 about having concepts of a healthcare plan. This is kind of the concepts. This is not a detailed plan by any means. And going through some of the provisions, and frankly, a lot of this are things that President Trump has talked about before, at least in concept. There's not much new here. On drug prices, I mean, you have to give President Trump credit for talking a lot about bringing drug prices down. He did that in his first term. Mm-hmm. He's done that in his second term as well. There's been, he's had very strong rhetoric going after drug companies. When you look at what he's actually done, it's not clear how much of a difference it will really make for affordability for patients. Mm-hmm. So, for example, he's talked about accelerating the move to over-the-counter drugs. And, that can make drugs more accessible for people. But perversely, it could actually cause people to pay more for their drugs, because insurance generally doesn't pay for over-the-counter drugs. Yeah. So you might go from paying, a $5, $10, $15, $20 copay to having to pay the full cost of the drugs because your insurance isn't paying for it.
Really glad you brought that up, because this is something I actually wanted to talk to you about as well. We frame everything on this podcast in context of rural. And when I think about all the rural places I've traveled over the last almost 30 years, the absence of pharmacies and drugstores, CVS's, for example, Walgreens and so forth. And I would imagine that for rural, we're talking about a completely different level of costs involved because of being able to keep inventory and so forth. Though these are the details that are important for us to not deal with later, but manage before something like this happens and it ends up boxing people in rural communities out of their prescription drugs.
Yeah, certainly. And I mean, there are certainly real problems with access to drugs. And it's not even just rural areas anymore. I mean, we've seen these pharmacies close in urban areas as well. I mean, it's happening in my very urban community of Oakland, California, where many of the pharmacies have have been closing. So the access is a real issue, but the affordability is certainly an issue as well. Now, the other thing Trump has talked about is creating Trump RX, an online drugstore for people. And again, for some people, that could produce more affordability. If drug companies are offering prices on Trump RX that are comparable to what other countries pay, and prices in other countries are roughly half or a third of what we pay, that could be great. But Trump RX would only be for cash paying patients, not for people with insurance. Fortunately, most of us have insurance. So again, going from having your insurance cover the drug and paying a copay to having to pay the full cost on Trump RX, let's say, that's not going to do you much good. And a lot of this has been happening with these deals President Trump has been making with individual drug companies. That's not the same as passing a law. It's not the same as a government regulation of prices. We don't know what's in these deals. They're not public. We don't know how much drug companies will actually follow through on them. The drug companies are coming to the table and making these deals
voluntarily.
Voluntarily, right, to avoid the threat of tariffs. If that threat of tariffs is no longer there, will the drug companies really follow through on these deals? And when you look at the fine print of at least what we know about these deals, a lot of them revolve around providing lower prices, supposedly lower prices to Medicaid, providing prices to Medicaid programs that are comparable to what other countries pay. In fact, Medicaid pays the lowest price of anyone now in this country for drugs because there are legal rebates that drug companies have to provide to Medicaid programs. So not even clear those deals will result in lower prices for Medicaid programs.
Yeah, it brings it in my head. I'm thinking nobody's going to get away with this without wanting to make a profit, and transparency is not exactly the word that I would use about, as you say. I mean, we don't know a lot of things at this point. You bring up about bringing, prices down and affordability. And of course, affordability is the buzzword of the year. Of course, you wrote a piece that appeared in JAMA Forum titled with the question, really, how unaffordable is healthcare? And since we're talking, as I said, a lot about affordability, kind of walk us through that article because it's subjective, I guess. What does affordability mean to me versus somebody who is living in a different income bracket? So talk a little bit about that, if you will.
Yeah. And, I think this really arose out of the debate over extending the enhanced ACA premium subsidies. Those subsidies expired at the end of 2025. There are ongoing negotiations in Congress about extending them and doing it retroactively. Those negotiations, I say, are hanging by a thread at this point.
Right.
They're very unlikely to amount to anything. President Trump's great healthcare plan did not include anything about extending these ACA subsidies, and in fact proposed converting them to just giving cash directly to people and letting them buy. The implication is they could buy unregulated insurance. That might be great for people who are currently healthy, for people with health conditions, or people who live in very expensive areas like rural communities. Those direct payments may not go far and may not make coverage truly or healthcare truly affordable. But when you kind of pull back and you think about affordability, you can think about it on many levels. You could think about it as what we as a country spend on healthcare. We spend almost double the average of what other high-income countries spend, over $13,000 a year now per person, approaching a fifth of the economy we spend on healthcare. But that's very kind of theoretical and intangible for people. What people really care about is what they themselves are spending. What's being taken out of their paychecks for health insurance, which for family now averages almost $7,000 a year, and that feels like a lot to people. But amazingly, that's not even the whole premium. People who have employer-based insurance, the employer is paying most of it, and the premium per family now averages $27,000 a year, which is, like the cost of buying a new car.
And high deductible plans. I literally just had a conversation this morning. I won't disclose with who, ER visit with their son, we're talking 10 grand right off the bat, and that still doesn't meet the family's deductible requirements for the year. So affordability, again, quite subjective.
Yeah. I mean, and there's been this push to high deductible plans, having people have more skin in the game. I think people have a lot of skin in the game now. And, particularly for low and modest income families, if you're talking about a deductible of $10,000, that's going to feel like not having insurance at all.
Yeah. And, Larry, I was looking for this on the KFF website. I haven't found it yet. Maybe but I was thinking about, again, from a rural perspective, employer-based plans are not as prevalent as they are in other areas. And so we take a look at so many people in rural, gig workers, self-employed folks, farmers, and so forth. It's a very different landscape for them, is it not?
Absolutely. And that gets back to the Affordable Care Act or Obamacare, which, in many ways has been a lifeline for people in rural communities. I mean, over a quarter of farmers and ranchers get their coverage through the ACA marketplaces. And that's why those enhanced premium tax credits were such a big issue. Without those enhanced tax credits or premium subsidies, the premiums that people pay out of their own pockets are going to more than double or increase by over $1,000 a year per person.
Yeah. Oh, my goodness. All right. So in another article you wrote, you're very busy writing, but this was back in June of 2025, still incredibly relevant. You started out by pointing that, MAHA is a worthy goal, and it's make America healthy again and make rural America healthy. People hear me say, I wonder when the again is, because rural has been identified as older and sicker and poorer for as many decades as I've been doing this work. But it is an important goal for us to be focusing on. And it would seem nearly impossible to consider that we're going to be healthier considering our current circumstances related to cuts in federal healthcare spending, almost $1 trillion over the next 10 years or so, which was in HR 1, and the ACA premium tax credits, as you just mentioned, which has, as this conversation is dropping, has not been extended. So what are your thoughts about how realistic it is from this plan, this Great America Health Plan, and all of this other stuff going on from a legislative perspective? How do we achieve healthier with all these uncertainties swirling around us? Any ideas?
Yeah, I mean, there's a lot in the MAHA agenda that, I think would be broadly supported by people across the political spectrum and across the country. I mean, we do have higher rates of chronic disease than the rest of the world. We don't always eat healthy. We don't always exercise as much as we should. Getting additives out of foods we eat. I mean, I think there's broad support for those ideas, and they would make us healthier. The challenge is that that's coming along with massive cuts in federal health spending. $1 trillion in cuts from the so-called One Big Beautiful Bill Act last year, which is expected to lead to 10 million more people without health insurance. The expiration of the enhanced ACA premium subsidies, which are expected to lead to another 4 million people without health insurance and higher costs. So, on the one hand, we're promoting health through the MAHA agenda, but on the other hand, we're making healthcare more expensive and harder to access, and that's certainly not gonna make us healthier.
Yeah, and on top of that, we also look at the other side of hospital closures. I just read something yesterday. A double-digit number of Pennsylvania hospitals on the verge of closing. Another piece yesterday about Colorado and Kansas hospitals. So it makes it really rough when you think about the fact that these rural hospitals, they typically own the clinics, not all of them, but when a hospital goes, the clinic goes, the doctors don't come, and it just, again, the domino effect that we're seeing. Okay, I'm going to go here because in this ongoing series, as I said, we're tracking the RHTP, this $50 billion taxpayer fund that is supposed to be, allocated for transforming rural health. The rural health landscape looks quite different than it does in metro places. We all know that. So let's talk for a few minutes about how some of the early concerns people are having about not having the details as of yet. So, and I think there's a considerable amount of us out here who are, we've got our fingers crossed, but as they say, hope is not a strategy.
Yeah. And this, this is a $50 billion fund. which I think in isolation would be very welcome in rural communities and rural health systems. It's $50 billion over 5 years. We've seen some of the details of the initial $10 billion allocations. And, they vary somewhat by state. For example, from a low of $147 million in New Jersey to a high of $281 billion in Texas. But when you dig down and you look at, okay, how much does this money represent per rural resident? And there, the range is just enormous. I mean, so for example, in Texas, it's only $66 per rural resident. Texas is a big state with a lot of people living in rural areas, and this money is not being targeted to the amount of number of people who live in rural areas in the state. And when you line this $50 billion temporary $50 billion rural transformation fund up against the $1 trillion in cuts over the next 10 years, which are permanent, and you look specifically at rural areas, that $1 trillion in cuts translates into $137 billion in cuts. This money won't even cover the cuts. So it's important, an important infusion of money. It will help with workforce issues. It'll help with improving technology, telehealth, interoperability of electronic health records. Some of it is tied to MAHA goals like physical fitness tests, limiting what people can use, SNAP for, what kind of foods they can buy. This money will do good, but it's coming at a time when there are huge cuts that will also threaten rural health systems.
Right. And I think we forsake the fact that, fitness, let's just talk about that for a moment. I think about how many rural school districts have lost their funding for just PE programs and so forth. And so I think about an investment that's kind of being put into a dark hole, because if the support services are not there to actually implement in the administrative costs and so forth, my fear is that we're going to see a lot of this money go to administrative costs, startup costs, and as one of our previous guests said, new toys that really, they go into the drawer with all the other electronics that you no longer can use anymore. And I hope that is not the case. Plus, I think we also have to take a look at so much of what's in this healthcare plan. It's going to require Congress to come together and actually make some things happen. And I don't know if you guys are paying attention, but it's really hard to get bipartisan support for many things around healthcare these days.
It is. We've seen, like glimmers of bipartisan cooperation on, some recent health funding legislation, regulation of pharmacy benefit managers. But yes, it is very hard to get Congress together on anything these days.
Yeah. Well, speaking of that, before we let you go, I'm just wondering if you have any insights into the 2026 Labor, Health, and Human Services funding bill that just came out this week from the House, and now it moves, as I remember it, right onto the Senate. So any insight where you think that's going to go from here, considering, again, everything that's happening?
Yeah, it's, I think there are certainly concerns about what the Trump administration will do with this funding. We've seen them rescind funding, eliminate USAID, massive layoffs across HHS. But, I think when Congress is coming together and making these funding decisions, they are rejecting, many of the cuts that the Trump administration has proposed. So, this looks a little bit more like a normal budget than what we've been seeing over the last 12 months.
Normal is welcomed at this point in time. Oh my gosh. Listen, Larry, you are welcome to come back and join us anytime. Any information that you have to update us, we'll be following your work. And for folks to know where to follow you, tell us real quick where they can find you.
Yeah, no, you can find all of our information on kff.org. It's freely available and, just consistent with our goal of trying to inform these big healthcare discussions.
Yep, and it's on my reading list every single morning. So I'll make sure that we put those links on our website. So thank you, Larry, for joining us. And for the rest of you, do not go anywhere because this conversation is certainly not over. We'll be right back.
The Rural Impact is on the rise. Thousands of subscribers and listeners, hundreds of downloads per episode, a growing community of influencers united by a shared commitment to lifting rural communities. We focus on sound policies that improve quality of life for more than 60 million people who call rural America home. This is your invitation to be part of the rural movement, because your involvement can help shape real progress and lasting success. Explore our partnership opportunities and discover how we help expand your rural reach while sharing your rural impact. Visit theruralimpact.com to download our partner prospectus.
Or email partnerships@theruralimpact.com to schedule a time to talk with us.
Are you ready? Let's go.
Hey, we are back. And as promised, we are going to shift gears to a new subject that is very much connected to health. And as it happens, very much closely tied to rural economies and so much more. And that topic is on agriculture, but specifically nutrition, food supply, and the Supplemental Nutrition Assistance Program, or as we all know it as SNAP. Now, for this conversation, who better to join us? I can think of nobody better than Food Research and Action Center SNAP Director, Gina Plata-Nino, who, as it happens, previously served as a senior policy advisor for nutrition and agriculture in the Biden-Harris administration's Domestic Policy Council, where she did help to lead the national strategy on hunger, nutrition, and health. Gina, I mean it when I say it is really great to have you back. I know you are super busy back to back with meetings. Welcome back to the Rural Impact. We need to hear from you today.
Thank you for having me.
Oh, it's our pleasure. So honestly, I do wish we were having a different conversation, but here we are talking about policy that will create hardship for millions of Americans across this country, millions of people in this country, with rural, of course, never being spared on this front, bracing for almost a double dose of pain is the way I'm analyzing these policies. Real quickly, I just want to mention to you that to our listeners and to you, in case you didn't see it yesterday, USA Today published a piece by Christopher Newbert and Kathleen Merrigan from Arizona State, and it headlined, and the headline says it all, 2026 could see the end of the Farm Bill era of American agriculture policy. And of course, it is the Farm Bill where nutrition, and this is my saying this, nutrition and food production policy, with the exception of a few programs out of HHS, that's where this all lives. They're saying that we might not even have a Farm Bill again. So on January 16th, your organization's president, Crystal Fitzsimmons, released a statement regarding the farm proposal by the Republican Senate Agriculture Committee, in which its leaders failed to mitigate harm of SNAP cuts on families, farmers, communities, and states. That's a lot. So let's dive in and lay out for our listeners the latest on this front. We are recording on the 20th of January. This is going to drop next week, just a few days before we could be seeing another shutdown. Maybe not.
No, and I don't think we are going to see the shutdown. I don't think there's any appetite for either Republicans or Democrats to engage. What was disappointed was, once again, there is this false narrative that who benefits from this aid, right? And who sort of should take priority. SNAP is an economic generator, right? The people who grow the food, they're the people who purchase it, right? It goes directly tied to our local economies. And the bill, unfortunately, by the Republicans included no sort of alleviation for the working families. Food may be growing in rural areas, but it's not access there because it is being sent out to other areas where people have to travel many distances to access this food. So once again, we see this, unfortunately, this idea that people who should receive certain benefits and others don't.
Yeah, and so much that was included in HR 1. I mean, the harms really because of so many factors, work requirements being one of them, and so many other things. But I want to talk specifically because we did have some folks on from Farm Aid, and they were talking about the impact of these policies on small and family farms. But your organization discusses projections of about $24 billion over the next decade in terms of a negative impact on farmers. Can you expand on that? Why? Why is that so?
Because we know how much the benefit amount is. We know how much people consume it based on USDA data. So it means less people are going to be able to purchase that food because they have less resources to do so. And we forget the original parts of the SNAP program was farmers had extra food. Someone needed to purchase it. And the federal government said, oh, people are going hungry. This is a perfect marriage. Let's make sure that people are accessing the extra food that individuals have. And it has had different reiterations over the years, but there's always been this understanding that the farm bill, that the farm community, it's interrelated because many of the people, we have different, right? We have our very large farmers, we have a small sort of farmers who feed their community directly. And many of them at one point or another may have benefited from the program because farming is a volatile job, right? Look at if it snows, if it's too cold, there goes your produce. So they understand and they understand how important it is for them to feed the community. And there's a pride that goes around that. So yes, we are seeing that not only the direct cuts that we see to SNAP, but there are the unintentional cuts that we could say that will happen, which is like farmers will lose about $24 billion.
Yeah. And with so many other pressures that they're facing as well. I mean, how do you keep your head above water? I don't see how that happens. So let's talk a little bit about the cost shift to states. And you guys talk a lot about the decisions that they will be forced to make. And that really is the right word to use. I think, and I wrote about this morning. Someone told me, listen, I don't really pay attention to health policy. And I thought to myself, how do you not pay attention? Well, I look at food policy. How are we not paying attention to the fact that states are not going to be able to just automatically carry this extra weight and then expect there to be equity in the distribution of how these funds that make it to families, ultimately to their grocery stores and their tables. So let's talk about the cost shifts. What kind of break it down? What are some of the costs that will actually shift over? It's not just one thing, it's many things.
It is. So there's various provisions in HR 1 that are happening that are causing the state agencies to having to need more capacity, right, to be able to administer all of these changes. When we talk about capacity, we really mean money and funds that the state needs to be able to provide for the state agency to make sure that the program is running accurately. So we're seeing two cost shifts. Beginning next fiscal year, the federal government will only cover 25% of those administrative costs. That means that your state is going to have to provide another 25% in order for the program to continue at a time where the state agencies are being asked to do more with less. And then beginning FY28, the state for the first time in history is going to have to pay a partial benefit amount of benefit costs. And it's significant because, we talk about rural areas, we talk about states, but SNAP has never been a line item budget, right? Because it's been fully covered. Majority of states' budgets goes to healthcare, followed by K-12 education.
Right.
So even individuals who say, well, I don't follow healthcare, I don't follow this, but maybe I have children. And all of a sudden my town couldn't hire that teacher. That's because of the federal disinvestment that's trickling down. Why are our taxes rising? Why are property taxes rising? Because you need to increase. Even for some states who may say, well, I may not be responsible for those cost shares. Many of the states are experiencing at the brink of a recession. There is no new investment coming in. So all of that trickles down. A dear friend of mine says that when states catch a cold, municipalities catch pneumonia.
That is so true.
So you're going to be seeing at a local level where people are like, okay, how are we going to continue to be able to provide this? Because if states can't do it, and the Congressional Budget Office says this, that many states are going to make it more difficult for people to access or pull out of the program entirely, that means that the millions or billions of dollars of SNAP benefits that were coming into your community, because that's the way it works, right? Federal government gives it, individuals put it in a card, it goes straight to that grocery store. That grocery store operates on a very small margin, particularly in rural areas. It may be the only ones. And when 50% of your customer are SNAP recipients and they can no longer utilize that, that means that this grocery store owner, small business, can no longer pay the rent or pay their mortgage, so they will close. When they close, that means less income federal in both taxes, and then less people that you are hiring. So it's just such a negative
Gina,
cycle.
what you have just done so brilliantly is do exactly what we intend to do, which is to connect the dots. if only it were just this. But the magnitude, the ripple effect of what happens as a result, and these are going to cause long-term pain. For what gain? I mean, and we don't have to go into kind of what I'm thinking, what I'm looking at in terms of the budget that was just, we were talking about it earlier, the markup from the House about what the FY26 budget looks like. But at the end of the day, I also want folks to recognize that food is medicine.
Yes.
We're talking about, and we're going to talk about before I let you go, we're definitely going to talk about that. But, scaling back of the funding for the actual food to table, but we're also talking about the scaling back of funding policy that scales back funding for technical assistance. We talked earlier or late last year about kind of the reorganization of USDA field offices and so forth. Where do you see the impact on the ground of scaling back technical assistance, and maybe talk about it? That's the relationship to SNAP.
Everywhere, right? The U.S. Department of Agriculture has technical assistance for rural programs, for SNAP program, for the state agencies who are trying to implement this program. And then the state agencies are being penalized if they don't do their job correctly. But the way I describe it to people is like you're asking your boss for guidance so that you can do your job, but your boss doesn't respond, right? Like USDA has laid off under DOGE people with with institutional knowledge that they could have helped these individuals navigate. They haven't provided the necessary guidance. And when they do provide it, it's inconsistent, right? Like last month in November, they issued 3 different sets of guidance that they had to update. And so you're like, but if they do it incorrectly, they are the ones who are going to be, responsible for this. And I think it's also like, you talked about food as medicine. They defunded SNAP education, which taught people, nutrition, how to help. So it's, how do you talk about food as medicine? How do you talk about accessing individuals when you're taking those resources? And at its core, we need to remember that hunger is the worst health outcome, right? We know all the negative impacts that it has on your body, on the economy, on, a weak workforce, disciplinary issues in schools. We know it costs almost $180 billion a year for our economy. That's how expensive it is. But we also know what the solution is.
Mm-hmm. Yeah, we do know what the solution is. And it confounds me that this is so hard. All right. So now we talk about eroded benefits. And I think, and I really love the way that you all have laid it out, because, what we really need to take a look at is what's being taken away. The why, again, I am challenged to talk about, but I have some understanding why. But the impact it will have on access, like, for example, on internet expense is no longer a factor in calculations. And why this is important, because we're pushing in the Rural Health Transformation Program, we're pushing technology and the use of, technology, but then you have this. So I feel like we're on one hand, we're holding it up. On the other hand, we're just punching ourselves in the side of the head, because it doesn't make sense. They don't comport the two.
No, especially for rural areas where broadband is even more expensive, where you rely on it more because things are so further apart, right? Automation has terminated a lot of the jobs that are available. Computers are not a privilege, they're a necessity, but for many individuals, it does become a high expense. And where depending on your zip code is either more accessible or not reliable, this has a negative impact, where we recognize that internet broadband is like another significant mandatory utility in order for children to be able to go to school, to access healthcare, for me to go to my job. And in rural areas, there is not enough access. And so to say like, nope, you can't cut this as a deduction, it means that you won't be able to show a significant, an adequate SNAP benefit.
Yeah, absolutely. And I think I'm looking at a line item here right now in this budget, which allocates $15 million for maternal produce prescriptions, for an example. But if you don't have the grocery stores in rural communities that have the produce, oh my gosh, it's so complex and sticky. At the end of the day, Gina, I think it's important for us to lay out who pays the price from these policies, the positions that they're taking, and not funding the programs and putting up all sorts of roadblocks, if you ask me, on accessing the programs. In terms of individuals and communities, you did talk a bit about how counties will pay, and we are going to be talking to county officials over the next several months about the impact on their budgets from cuts all over the place. But lay out a little bit about, what you're seeing in your predictions and the models that you have put out about who will pay the price and what exactly will that look like?
Yeah, anyone who's not a billionaire or a corporation will pay the price.
So
right?
raise your hand, right?
No, I say that because there's this was the bill was like the biggest transfer of wealth to the top 20%. Majority of Americans, we are not in that. And nowhere do you see that more than in rural areas, right? Federal disinvestment, low jobs, lack of childcare. There are many issues within rural areas that need to be taken into account. Closing of healthcare systems is another, right? A closing of grocery stores. So who's going to pay the price, right? The grocery stores who are closing, meaning that individuals are now going to have to travel further distances to access food, whether or not you're on SNAP, which means that your food is going to cost a lot more money because now you're traveling further distances. That's one thing. Counties, we have 10 states that are county operated. Some of them are responsible for 100% of those administrative costs. I mentioned that they now, beginning FY27, have to pay 75%. Where is that money coming from? Most states no longer have a rainy fund. Rainy funds are like an emergency happens, but it's not ongoing. It's not sustainable. Many of states ended on with a deficit of millions of dollars. Where will this money come from? And that's why I mentioned taxes. So whether or not, you're impacted by the healthcare costs or the SNAP costs or what happened with education, well, your bills may rise in terms of why my property tax is higher. And again, in rural areas, there's more distance between land, there's less property. So that means that fewer are going to have to be responsible for a large pocket of cost than they are in more areas where there's more urbanization. So all of us as Americans will face the price because of the generational disinvestment, right? Children who won't have access to food. We saw during the shutdown, for example, in Oklahoma, people who didn't get their SNAP benefits on time, there was a higher increase of evictions, right? We're going to see a higher raise of unhoused individuals because people, when 80 to 90% of your income is going to shelter, you have very little left when emergencies come up. And so we're going to see more of increase in poverty, which affects us all as a nation, because cities and states could have invested this money into better childcare, into more education, into better roads, into better transportation. But now states have to step in for federal disinvestment, and they don't have those resources.
If I could just say to our listeners, I have a closing question for you. But first, I just want to say now would be a really important time for you to be paying attention to what's happening at your state level and at your county level, because Gina, I agree with you. I do work, for example, with hospital districts and ambulance districts, and they really hesitate to go to their communities to have a levy increase to cover things that that they need to cover. And most rural communities do not have the biggest appetite for seeing a property tax increase or a special purpose tax. But at the end of the day, somehow, this has got to be paid for if we're going to make sure that our communities are fully resourced and that no child goes hungry, as they say, and that we work at addressing this to the point where we can sustain it versus, to your point, reaching into the emergency funds to try and, put out a raging inferno when we should be managing the fire. Okay, so the last topic I want to talk to you about, there's a lot of talk about make rural America healthy again, make America healthy again. And I've said before, I'm not sure what the again we're referring to. What I look at is the present and the future, and how policy has the power to influence whether we lift people up, communities up, provide them with what they need, or conversely, what happens on the other side, which is what we've been talking about. Rather than ask you how these policies are going to hurt health, let's talk about what would help. Let's talk about what would help make rural America healthier in terms of access to food. And from there, maybe some things that we need to be talking to our legislators about to make that happen.
Let's start with access. I think that's the key word. The previous federal guidelines said it best in their introduction, where it says, how can people access a healthy diet? They need to be able to afford and purchase it where they live, where they work, and where they gather. We do know the majority of places are not benefiting from that. They are very limited places where people can be able to purchase food, fresh produce, food that they need for their families. When you have to travel 30, 40, 50 miles, you only purchase once, because can you really afford the gas? And many people don't have their own transportation. They have to pay someone to get them. And I know I hear a lot of people say, well, there's online places. That charges a lot of money. And in some rural areas, it doesn't cover it. It's just not significant for individuals to be able to benefit from that. There's an entitlement mentality in terms of how people access food without really realizing what can we do? We need to make sure that there are no SNAP cuts, right? How can you say we want to make people healthier again if people don't have the resources to be able to purchase their food? They have to make really difficult choices in what type of items to buy. Healthcare needs to be supported. Transportation, more funding for more stores to go into places. Those are the things that we need. We need more funding, and we also need grocery prices to decrease. The fact that many of the items, whether it be meat, whether it be fresh produce, particularly with liberation tariffs and so on, food is expensive. Mm-hmm. And, we always say that SNAP is about $6 a day. We can't really say that anymore because food is really expensive and those $6 don't go far enough.
Yeah. I'm so tired of hearing the word affordability because affordability is subjective. It depends on how much money you have in your wallet, so to speak. And so I'm going to just encourage folks, you go to a rural community, there's a lot of tourism. And I want you to go into the local grocery store and note how much a small jar of peanut butter costs. So, again, we got to make sure that policy is addressing everyday people meet them where they are. And I'm really glad that you talked about who is benefiting from this as well, the billionaires. Oh my gosh. Gina, you are welcome to come back anytime. Any news you have for us on SNAP and where the interface with rural. I mean, of course, again, this is very near and dear, and it should be to our hearts on this podcast in particular, because SNAP policy is not just about feeding people. It's much bigger than that, although that is at the heart of the matter, as they say. Gina, real quick, where can people find you and where can they read about your advocacy efforts so that they can get on board and do some effective advocating for better SNAP policy?
Yes, they can go to frac.org. And Michelle, I just want to say that it's important to say that this is an issue for everyone, regardless of what side of the aisle you're in, regardless of your income guidelines, regardless of where you are. It impacts all of us. We as a community rise together. It's a sum of us argument, right? We all rise when there is investment into our communities. So people can go to frac.org. And there you can find all of the research that we have, but also how you can engage with your state legislators, with your federal legislators, so they can hear loud and clear that if you care about rural communities, you have to care about healthcare, you have to care about SNAP, so that people can have the access and the resources so they can live healthier and more meaningful lives.
Absolutely. Well said. Well said. Oh my gosh. Well, even though we have to say goodbye to Gina, just stay with us for a few more minutes because I'll be back with some closing thoughts here on the Rural Impact. We'll be right back. My sincere thanks to Larry Levitt and Gina Plata-Nino for their insight. And to all of you, again, I'm so grateful that you've joined us for another Dot Connecting conversation. A quick reminder, our merch is now available on our website. So head on over to theruralimpact.com. We cannot wait to hear your feedback when you see what we have in store for you. And while you're on the website, go ahead and hit that subscribe button because that way you'll get our newsletters when they come out to you from time to time. And again, I always invite you to subscribe wherever you like to get your podcast. And please leave us your comments and send us notes and let us know the kinds of policy issues you would like for us to cover here again on the Rural Impact. To Sarah Garvin and Bria Corsaro for all the behind the scenes support, I thank you. And until next time, I'm going to invite you once again to please take really good care of yourself and to the best of your ability, all of those around you. We'll see you again soon on a new episode of The Rural Impact.